Living the dream.
Yeah, had a sick kiddo today, unfortunately, so
Oh,
you're all set.
great, thanks. So welcome, everyone. Looks like first thing is calling us to order, which I just did. And introductions, I think everyone here knows everyone. Am I right? Yeah, okay, so we can probably skip that. Hopefully you all got the revised agenda that has suicide prevention and crisis service over target request is going to be presented today instead of the original agenda that had something a little different that we're going to do in September. And let's see, any other additions or deletions to the agenda?
There is one more discussion point on the Conference of Local Mental Hygiene Directors. So all of the counties have a Director of Community Services, and then they have a conference or group where they come together, has asked us to review a resolution around 730 orders. You should have all gotten one over here, so we can just add that as another.
This page right here?
No, that's the thing that,
Oh, I see, yes.
it looks like, it just, it's in sort of legalese, resolution calling for members of New York State Senate and Assembly. The idea behind this is that if you approve this resolution, you can go to our local legislature. And the conference has some lobbyists who feel that if all of the counties in the state send a resolution to the Senate and the Assembly of the state, they'll have to pay attention to this issue because they'll have gotten it from so many people. So that's one of their hopes.
Okay, so where did you want that on the
You
agenda?
can just put it at the end.
Okay. And you'll be filling us in on that.
I will fill you in.
Okay, great. Approval of minutes. Everyone had a chance to take a look at the minutes. Do I have a motion to accept?
I have an edit.
Okay,
For the grant, that the System of Care and, Human Services Coalition got, it is a $10,000 grant, not a $100,000 grant. Also, the Family and Children's Services presenter was Alicia Sudsmo, not Lisa. I think it's ALECIA. Yeah.
It is ALECIA.
thank you. So we had a motion from Sheila. Do we have a second? Okay, and then that's typically when, is there any discussion or other edits? No? Okay, then all in favor of the minutes as presented with that edit, and I gave Cron a couple small edits of the numbers at the very end there. So that's all that. All right, so next is privilege of the floor. Any questions or comments from the board or guests? It's hard to, I can't see people this way. They're all blurry, but then I can't read.
Can someone hit the okay just so we can more easily see the
If what?
online guests on the Zoom meeting? If we can click
Do
okay
you have
to
the
that
mouse?
prompt, then we can more easily see Larry.
Oh, so we see everybody, you mean?
Yeah.
Or maybe the box to make them bigger.
Okay, so next is any board correspondence or announcements. I don't have any. Do you have any, Harmony, or anyone else? Okay, then I think we're ready. Is Tiffany on there?
Yep, she's on.
Okay,
She
so
is,
we,
Tiffany, before you jump in, Jan, if it's okay with you, I want to add some budget context for this year, just so you guys are aware. The county legislature has through our new finance director, has made some adjustments to how they want to handle OTRs, particularly from outside agencies. So in the past, we've been able to take OTRs with a particular agency attached to it to the legislature. But the new finance director's interpretation of the procurement policy of the county does not allow us to do that any longer. There has to be a competitive process for any amount of money over $50,000. So we actually have two OTRs, one from REACH and one from the Mental Health Association, that had previously come through our department, but they have now been instructed to take those requests through the Human Services Coalition process, which is a competitive process. And so that's why you won't be hearing about those tonight. This one that Tiffany is presenting to you all, we are going to take through the department. If you all believe it's appropriate, we would put it through the department, but it would be for a type of service and an amount of money. If the legislature decided to approve the OTR, then we would have to do a competitive procurement process through an RFP. So hopefully, Tiffany, this isn't the first time you're hearing this, but if it is, I apologize. It is simply because of a change in the financial interpretation of our finance department, that these all have to go through a competitive process. It is my hope that the county policy will get amended or changed in the future, but they are not ready to do that. So this is the process we've been instructed to follow.
Does that mean that not all can get the money, or, I mean, I'm not sure what the difference is with the competitive process.
Sure. So in the past, an OTR, like let's use the Mental Health Association, for example. If you remember, they asked for some money for the drop-in center on the Commons for their space. And the legislature approved that specifically for the Mental Health Association. Now, what would have to happen is we'd have to say, we want a drop-in center on the Commons. We think it's going to cost X amount of money. Legislature, please give us authority to do that. And then once they do, we have to go through a competitive procurement process, meaning an RFP, where we would put it out and anyone could apply, and we would have to look at all of the applicants and make a determination on who we thought was the best respondent.
But Frank, I don't understand why the change in policy. Were we doing it wrong before all this time, or?
Well, it's a change in interpretation of the policy, because we have a new finance director and the legislature has concurred with her new interpretation. So until such time as that interpretation changes or the policy gets changed, this is the direction that they're giving us.
And Frank, why is it that one group is coming to talk to us, but the other two are not?
Because this is really a community effort, and Tiffany is kind of taking the lead to, present the information to us. But ultimately, it will be a departmental ask for funding to do what Tiffany is going to explain to us here. And then we would have to go through a competitive process to find someone to do it. The other folks are doing it because neither of those came out of the local services plan or the department saying this was a need based on, subcommittee work, board work. They were specific asks from a local community-based organization. And so those types, if they want the money specifically for them, they have to go through that Human Services Coalition process. This one will have a different process, but will still be competitive.
Frank, maybe I misunderstood, but I thought you were talking about the amount. Is it related to the amount of the ask?
Anything over $50,000 has to go through a competitive procurement process. Anything between 20 and 50, we only have to get multiple bids.
Does that mean that in the future, agencies will have to plan ahead further, or so you can request it in an appropriate way, and then the RFP can go out, or RFO, whatever.
Yeah, if there is ever a time where the board or the department says we need XYZ service in the community and we need county money to do it, we can always go through this traditional process where the department puts forward the ask. But after we get approval from the legislature, they will only approve the money and the program. They won't approve a vendor during the budget process. After
Okay.
the budget process is complete, we would then have to go through a competitive process to find the vendor.
I see.
I have a couple of questions, if you didn't see me, Jen. One is MHA going to ask for the money for the drop-in center again? Because I thought they were closing the drop-in center. And the other is, and this is more tricky and you may need to think about it, can the Community Services Board, as a knowledgeable and stakeholding entity, express support or preference for a particular vendor to do the particular program? For instance, if the whatever the process, whatever Tiffany is going to discuss with us, can we say after it goes through and the legislature approves the amount of money and the idea, can we say as the Community Services Board, either while it's happening or after it's happened, that they've gotten approved, that we prefer that this group get the money, or are we not allowed to do that?
You would be able to say that in a meeting, but it wouldn't have any sway on the process necessarily. So I guess my point being, you can say whatever you want, but when we get into a competitive RFP process, it is a silent process, meaning it's blind. People apply to the RFP. We don't see those applications till the RFP closes and we get them all at once. And then a review committee has to review those RFP against an established set of scoring matrix and then make the best decision. Now, if we know the people on the committee obviously take into account all the information available to them, but there would not be an opportunity to direct the department to give the money to one person or the other.
I mean, as much as I love to direct people to do things, I understand that we wouldn't be able to do that. At this moment, could we go as far as to issue a letter of support as the LGU or the Community Services Board?
That seems off to me.
Yeah, I mean, I think that you might be going a little too far. I don't know what the Human Services Coalition's process is, to be honest with you, because I haven't gone through it. I do expect the people applying do get letters of support. I think the one thing the board would have to be mindful of is the Human Services Coalition, while it's not an RFP process, it is still a competitive independent review process. And so we have to be good stewards of the taxpayers' money. And so a component of that is having as equal and as fair a process for every applicant.
Got it.
Weighing in might go a little too far. I would say though, to your question, well, I guess that was your first question. The Human Services Coalition process, because it is similar to an RFP, does not have a public comment period in it. However, when they submit all of the awards that they are proposing, those then go to the legislature as part of the budget process. And there is, of course, a public hearing and privilege of the floor for the legislature during the budget process. So there is an opportunity at that point to personally weigh in if somebody so chose.
So I guess I'm still having a little trouble getting used to this. So the Mental Health Association and Suicide Prevention and whoever else you mentioned, they're not all going for the same pot of money or the same RFP that would go out or competitive process, or are they?
Okay, so the RFP and the money pot are separate things. The money pot is all county money, so it's all the same pot, right? So if REACH, Mental Health Association, and this OTR all get funded, they're all coming from county taxpayer dollars, so it's all coming from the same pot. The RFP process is just a way to get a vendor that can do what we need them to do and accept the funds that the legislature has allocated. Anyone that's eligible can apply for the RFP when it comes out. So all three of those agencies could compete for the same RFP if they felt it, fit within their mission and it was something they could accomplish. So asking for the money is one piece of it. Deciding who gets that money is a separate piece.
I guess I didn't explain that well. What I wondered is, are they all looking for the same looking to provide the same service?
No,
It's
these are all
different.
They're all different, right?
Thank
So
you.
REACH is a nursing thing, mental health is the drop-in, and we're about to hear from Tiffany what these dollars would be for.
Great, thank you so much. Does anybody else have questions about that? Larry, were you done?
Yeah, I was done.
Okay. All right, are we ready for Tiffany then? So Tiffany Bloss, who is the Executive Director of Suicide Prevention, will be talking to us about their over target request.
Hi, I appreciate having the opportunity to share this. The proposal, hopefully everybody got a hold of that and had a chance to take a look at it. We have had a Tompkins County Suicide Prevention Coalition in the community for quite some time. It meets fairly regularly, but it is all volunteer based at this point. Makes it really hard to get initiatives pushed forward and have someone be able to focus their time steadily on that. So what we're proposing is for a request for a coordinator that is paid to really hone in this coalition and motivate folks to be able to put action to some of the goals that are put forth by the coalition. I know that this was on the health services goals and objectives, and goal number 3 to be able to support the coalition. We are one of the only counties in New York State that does not have a part-time or full-time paid person that supports the coalition to really get that focus and motivation in the community. We here at SPCS are seeing an astronomical rise in people who are having suicide behaviors and attempts on their lives. Just in the short time that I've been here, we've almost quadrupled the number of contacts that we're receiving. We're consistently increasing staff. My first year, 2 years ago, we did 6,200 contacts, and we're on target this year for over 25,000 contacts. It's really, really increasing, and we need to have more support within the community to really target the school districts and the hospitals and really get some of these initiatives in prevention so that we have people in better support. And I think that someone who's dedicated to that would do a lot better job having that focused time. And we've seen that with a lot of the other communities that have really successful coalitions.
Thank you. Jessica has a question.
My understanding was that, that our children's FOA coordinator had been serving, partially in this role. With her retirement, is the expectation that that the role of helping to assist with organizing the coalition will not be assigned to the new CSPOA?
Right, yeah, she's doing it a bit of as a favor to be in this role right here. Yeah, we really need someone that's focused in this area and can keep the drive forward. We've got some really great committees that are doing some good work, but that motivation and accountability behind it is necessary to push these initiatives forward.
Other questions or comments? Yeah,
Yes, Tiffany, so you're saying 8 hours a week? That doesn't seem like a lot, but, and you have quite a schedule of responsibilities for them. And do you think that you can find somebody that can fill this role for 8 hours a week?
Yeah, the great thing about the coalition is there's a lot of people that are a part of it. It's just that like that motivational, keeping checks and balances in place and really reminding people of what they're gonna do to get that work done. So it's that leadership convener that can kind of push that forward. And we actually have an in-house social worker who is willing to take this on.
Thank you.
I just have a comment.
Okay, yeah, Jessica has another comment.
So I am a member of the coalition and some of the subcommittees and the Zero Suicide Task Force. So take my biases with a grain of salt, but I would be in significant support of this. There's been turnover with like the public health fellows who often support some of these initiatives. And I think there's a lot that Tiffany and her organization go above and beyond to do. There's a lot that like people from a lot of different organizations go above and beyond to do. And I think that having a dedicated person would likely be really impactful.
Thank you. Anybody else have things to say? Larry?
I do. I apologize. I haven't seen the, or if it was attached to something, I didn't get a chance to read it. How many hours a week is this person or the position going to be?
Eight dedicated hours every week.
And the amount is, I was just gonna say the amount is 16,400,
But that's not just the salary, that says budgeting and stuff as well. So,
right?
Was that a number that the coalition arrived at, or is that a number that people suggested because it seems reasonable? Because it seems awfully low for if we really want somebody to take on the work that the coalition wants to have done.
Right. So like I said, the great thing with the coalition is there are a lot of committees and there's a lot of members to it. It's just mobilizing them. There's a lot of conversation about really great plans and there's a good strategic plan that's there. It's just someone being at that forefront to be able to implement that with everyone.
Yeah, I'm not arguing about whether we should have a coordinator. I'm arguing about does funding 8 hours, is that adequate for what we envision, or should we should it be a half-time position or even a full-time position? That's my question, because it feels like 8 hours a week is a very small amount of time for somebody to put in to do all the things. I haven't been to a coalition meeting in a while, but there's a lot of work that the coalition wants to have done. And so I wonder, should it be 16 hours a week or 25 hours? 8 hours a week doesn't seem adequate.
I'm sorry, I just need to interrupt. Harmony, there are people downstairs that need to be let in.
Maybe there's the possibility that if they feel that the need is greater after they get this funding, that they could always try to get more the next year. Tiffany, do you have anything to say about that?
Yeah, so we've talked with a lot of different coalitions in different communities and kind of talked with like what their tasks are and how they are. And if they're able to mobilize the volunteers that they have for all of the committees and all of that, it's feasible for them to be able to be 8. It's certainly like we could have 6 full-time suicide prevention people in the area, and that's still not enough because 100% of people need to be trained in things and educated and all of that. But this to mobilize the folks that we have and the committees that we have and really keep that accountability. It seems to be a pretty standard for the size of our community.
Okay.
Oh, and you said, Tiffany, that the person who's interested is in-house, the social worker. I'm assuming this person has already developed contacts with various partners in the coalition. It wouldn't be starting from the ground up.
Yeah, no, she's got quite a few contacts in the community. She's a licensed social worker. She's really invested in this work. We've talked very lightly about this as like a potential possibility. And she's incredibly open to it, to really like focus on our community and do more of this good work so that people are safer.
Yeah, I just want to be clear that I'm totally in support of this. I'm just arguing that from my vantage point, 8 hours. But if you've talked to other coalitions
Yeah.
and they feel like motivating the volunteers, that
Yeah,
this is not.
Larry, I agree. I was thinking the same thing. I think it's, I'm obviously very supportive about this, but I was thinking the same thing. It's an awful lot of work for 8 hours. I assume Tiffany and it'll be monitored, but I guess you have to start somewhere.
Yeah. Yeah, we also are developing a steering committee for the coalition as well, that will be on a volunteer base that is pretty strong, and we've got like a mini task force of a few of us that we've just come together in the community to get some of those actionable things going that have been talked about for a long time. So there's incredible motivation on the coalition. It's just that spearhead forward.
Tiffany, could you talk a little bit about that? What are some of the initiatives that you haven't been able to move forward because you don't have a part-time coordinator?
Yeah, so some of the things like we've got a couple of different committees. Our data committee, who is really great, really struggles to meet and get things moving and off the ground. And there's not anybody keeping anyone accountable or like, being that energy behind them to really get things going. Schools is a really, really huge piece, getting into the schools and talking to them about suicide prevention and being in front of the students. And it's part of that bandwidth and having people find that time to be able to do it. Because we've got a lot of volunteers that are really great with the coalition, but time is precious and it's really, really hard to find these days. So if we had someone where that piece of their job, even if it's scheduling all of that stuff for other volunteers to be able to do it, having that dedicated area would allow us that space to be able to get these things moving forward.
Knowing the value of time, I'm just curious how much of this budget is for salary versus the marketing and other expenditures.
So it works out to 400 and some hours a year. So I think 14.5 was for the salary, and then the rest was for printing and minor travel and other marketing materials that we would need.
Other questions or comments? Well, Tiffany, this was helpful. And I think we all see the need, especially based on your statistics.
Wow, yeah.
And is there anything more we have to do?
Yes, please. If you could make a motion to have the department submit an OTR to support this programming, that would be helpful to us.
Okay, so I'm going to make a motion that the department puts forward an over target request to be able to have a facilitator for the Suicide Prevention Coalition. Can I have a second or whatever? Yeah, or first and a second, sorry. Looks like we've got that. Okay, all in favor? That's everyone, so
Thank you.
looks good. Anything else, Frank or Tiffany, that you need from us?
Just to
I
thank Tiffany.
appreciate it very much. I think that it'll be a great thing. So thank you guys very much. I appreciate the time too.
Yeah,
Frank,
thanks
could
for,
you just give us a time frame now that we, approved this, you can move forward, the department can move forward. What is the time frame? Are we looking at 3 months, 6 months?
No, this is
Or-
a 2025 budget request. So we're in the process of building our budget right now that will go to the county administrator at the beginning of July. And then the legislature starts reviewing the county administrator's budget in September with a final decision usually in November for 2025. So this is a 2025 budget request. The
Okay.
money would not be available till January 1 at the earliest.
any other
January
questions?
1 of 25 or 26?
I'm sorry.
25.
25, okay.
Yeah, budget year 2025. We have our county budget year is the calendar year.
So given that time frame, Tiffany, should you be successful, how soon could that part-time coordinator start once pending approval?
Yeah, tomorrow. It
Oh.
would be a very rapid start.
But it would be 2025.
Yeah.
Yeah.
And
Yeah.
we have to have a contract with whoever the vendor is. So once we have approval from the county, we'll start the contracting process. And as soon as we can get the contract in place, then the monies would be available to the vendor.
Hey, Frank, has the county ever approved a request like this out of cycle? Can I get you know, some out of the budget cycle? Just is that something that sounds arduous, maybe?
Yeah. Oh, wow. Randy put me on the spot. Yes, they have, but usually it's earlier in the year. Once the budget process starts to roll, generally it's been the feedback that I've gotten is we should go through the budget process. If it's something that, absolutely is necessary, I think, it's there, the legislature's always been willing to listen. But we try once the budget process starts to stay within that.
Given the nature of this position and the statistics around it, is it something that may be worth seeing whether or not that's something that could be done out of cycle?
We can certainly ask. I would suggest that a lot of what we do is as important as what this position is going to be doing. And so when we start pulling one piece of it out, it
Yeah,
does
good
become
point.
a bit more challenging. But
Makes sense.
I agree with you, and we will certainly be looking to try to figure out how we do this in the interim, so that way we don't lose momentum. The department is a partner in this, and we're just as committed to making sure that the work continues and moves forward. So, we'll do what we can, from our end to make sure we can continue to support, and if and when this potentially gets funded. And I should point out that we as a department have been given a task of doing a maintenance of effort budget and one that reduces county spending by 5%. So we're already looking to cut existing things. Thankfully, I think we're going to be okay with not having to lose filled positions or really lose any programming. But other departments, I don't think are going to be in that similar situation with a 5% cut. So I just want to set expectations for everyone that this is going to be, at least from the direction I've been giving from county admin, this is going to be a tighter budget year than we've seen in a little while.
Okay, thank you, Frank and Tiffany. You are welcome to leave if you want, Tiffany, or it's up to
Thank you
you.
guys so much. I appreciate it.
Yeah, have a good evening.
Okay.
Next on the agenda is,
Can I ask
Yeah.
an unrelated question, but it is related to OTRs, which is,
Uh-huh.
Frank, can you clarify? I thought I heard that the drop-in center, that they weren't going to have it because it wasn't actually bringing people in off the commons. It was actually being used by people who are already connected to MHA. So I was wondering what, and I haven't seen there was a sign, a rather prominent sign, advertising that the drop-in center where it was on the common. So, and I haven't seen that sign for a while, and so I'm not sure. Do you know?
I mean, I'll be honest with you, Josephine's been a bit up and down on this location, and at the beginning of the year, there was some thought that they weren't even going to need this year's funding, but I think things have turned around a little bit in her perspective, and she was interested in seeking the funding again. It got shifted over to HSC just as we were about to do our more formal review of it. So we didn't do that formal review. So I don't know all of the details associated with it, but I do know that will likely be part of the conversation with the Human Services Coalition, because they have a limited pot of funding that they're going to be trying to administer to more organizations than they have in the past. So I imagine that process will flush some of that out.
Okay.
Any other questions or thoughts? Okay, shifting gears, we're going to talk about the local services plan. Harmony met with myself and the 3 chairs of the subcommittees, and we tweaked some things and put some dates in. And you all should have the most recent version. And now I think Harmony is going to do kind of a review of it. Is that correct, Harmony?
Yeah. So the actual local services plan, the full document is on our website. And so you can find that. You can go on Tompkins County Home Health, and you can find it under the Community Services Board where that section is. It's there. So anybody can find the actual document that we did last year. And remember, this was the first time, or for those of you who are new, we used to have to do a full plan every single year, which did not make a lot of sense, given that, it's sort of like your goal is to end world hunger, right? And you have a year to do it in, and then you start over again. So they're pretty big goals. So they've broken down into more years. So this is just a review process. And you'll notice I highlighted anything that was a change. And it feels like a lot of pages, but there's a lot of columns. And how I've displayed it is how I have to actually upload the information after hopefully your approval with some tweaks and changes and whatever you think we need to do a little bit differently. So it looks like a lot more than it is. If there's nothing that's sort of highlighted in a section, it means it's staying exactly the same. What I have to tell the state is you'll see there's a due date on the far right-hand side, and then there's whether it was completed, it's ongoing, or it's not applicable. So if, you're not working on something this year, it would be not applicable. If you are going to do it for a few years, it would be ongoing. And if you think you're going to complete it by the end of 2023, then you put it in the complete column. So you'll see some things had some minor changes, like if you go to page 2, well, back up, there's 7 areas we identified as needs. I think those are pretty constant needs. Workforce shortage, housing needs for people with disabilities, crisis services, cross-system services. So how things work if someone's in the Office of People with Developmental Disabilities and they need only Office of Mental Health Services, how does that cross-system function? Non-clinical supports, what other things do people need besides clinical services? Adverse childhood experiences, which we identified as both a need that impacts children and also for adults who have had adverse childhood experiences. And then transition age services. So for children who are aging out of the children's service system and into adulthood, how are we making sure that they get all the support they need? And so under the workforce, that was goal 1. The first area we changed is on page 2 at the bottom, objective they're out of order because I realized the first two objectives, number 2 and number 3 were supposed to be done in 2024. And for some weird reason, objective number 1 was supposed to be done in 2025. That seemed weird, so I just moved it. But we just did a small tweak on the language for that one. We went from workforce data collected in 2024 will inform advocacy efforts in 2025. And we wanted, instead of inform advocacy efforts, we wanted it to be used to create a strategy, an advocacy strategy. We felt like we needed a specific plan of how we're going to use the data we collect. Then there's not really anything that's different until you get to page 5. And you'll see that objective number 4, advocacy for housing services. We did the LGU opioid settlement funds program that has started. We've worked a lot on advocating for housing solutions, especially for emergency and supportive housing. So we've really done that. There are other objectives that are going to keep our eye on housing issues, but it didn't seem like we needed to carry that one over. Instead, we added a new objective number 5, that's monitor and support ongoing housing solutions for individuals with mental hygiene needs, because we know there are a lot of programs that are getting developed in our community, housing programs that are getting developed. But let's keep our eye on it over the course of our plan.
And Tiffany, that would include Catholic Charities, so the contract that they were awarded. Okay.
To keep our eye on it, yeah. And then under crisis services, so we just whizzed right through workforce shortage and housing. Crisis services, goal 3, I'm starting on page 6. Objective 1 was identify best practice crisis response across the mental hygiene system. We've developed a care team. The community's done CIT training for law enforcement. There's been a sequential intercept mapping process where you look at each intercept where law enforcement may get involved, and a person who has a disability area might get pulled into the criminal justice system. And how can you strategize to prevent that from happening? We did one 2 years ago for the entire county that the sheriff's office helped support, and we got a grant to fund that, and it actually paid for law enforcement's time, all the overtime that required for them to get that training. And then Cornell University is one of the first universities that just did that a few months ago. So one of the first in the nation to do that. So we've done a lot of those activities. We had it slated for 2025, but it looks like we're really completing that section a year early. Expand access to crisis supports. So we know, we just heard from Tiffany, 988 has really grown. Just a couple of years ago, it was a brand new number. Nobody knew how it was going to roll out and work. And you can hear how many people are actually getting a lot of benefits. So those numbers are really frightening to hear how many people are calling in distress. And it also means people are getting the support they need when they're calling. So there's been a lot of work on achieving that, and we'll have that done by the end of this year. There's a new objective under crisis services that was added, number 6 on page 9. And while we have our co-response team with law enforcement, what we don't have yet is a subacute non-law enforcement response. And that was something the community really had asked for, where if a person's having a crisis, but it doesn't really rise to an immediate emergency kind of a situation, there's no danger involved, is there a way to have a supportive process where a person could have someone come and talk with them and face to face? And having had conversations with Tiffany about this, there's a significant number of people that call 988 who are not at the level of they need the co-response model, but they could benefit from someone coming out and talking to them and linking them to services. So that's the one piece we don't yet have. We started with the people who are most vulnerable, triage at the top, right? And now we still have that area to do. We have that to be achieved by end of next year. Cross-system services, goal number 4. Improve public awareness of available services across the system. And we decided to actually, a change. We added language to expand this objective to include social health needs. because we have another objective in here that talks about people getting access to dental care and other things that are very important to people's overall health and well-being, but it felt like it was too far of a stray out of our scope of focus, and that we wanted to mention the importance of social health needs in people's lives, but we don't really have the capacity, the knowledge to address whether or not a dentist takes Medicaid. Like, that's not something we can do. So we added a social health care component to this objective number 1, and then just removed that other objective later on. So that's what that change is all about. And then number 2, remove barriers to accessing services across the system. I think, Jan, when we were talking about it, you said this could be our lifetime goal, because there's just so many challenges. If somebody we see this a lot with OPWDD and OMH, like if a person gets into the OPWDD system and they start to get services, if they had services in OMH, now they have to quit using those services because they've got services elsewhere. And sometimes people really need a blend across different state agencies of supportive services. So that's really a long-term. We didn't think the date in there was really adequate. So we put that to 2027. And I honestly, I think this ends in 2026. I keep trying to extend it another year. I'll get clarity. If it's 2026, we'll just put it to 2026. Although we probably can have it for a long time, because it's just hard to move large systems that are kind of in their tunnels, but are not necessarily always person-centered. Objective 3, originally scheduled for completion 25, we extended it to 26 because what we realized is we must have gotten tired when we made our plan and we put everything to be done in 2025. So we had to sort of start spreading a few things out, and felt like there needed to be some other objectives achieved first so that we could improving the coordination of services across the mental hygiene system. Felt like we needed some of the other objectives done before we could do that one. Use opioid overdose data to guide interventions across the mental hygiene system. We had that originally scheduled for completion 2025. And while there's been a lot of work that's been done, and our subcommittee co-chair is meeting with regional opioid task forces to learn about what their work is doing. Our Narcan providers are now meeting on a regular basis and learning from each other and getting a lot of good information. And the substance use subcommittee has talked with the people in whole health who are doing a lot of data collection. It still feels like it's such an enormous goal that we need as much time as we can get with that one. And we added a new objective: reestablish and maintain a withdrawal and stabilization program in Tompkins County, work to create and maintain an OASIS continuum of care. So I think this was Larry's point on this one, is that when Alcohol and Drug Council closed, we lost these services. We know that they're going to go up for a request for proposals once OASIS approves the RFP, and then it will be a local RFP process. However, in the interim, it means we have lost these, so we want to keep it on our radar and our plan. And there's the objective I talked about that we removed it. It was just too broad. Objective number 1 on page 12 under non-clinical supports. It went way in the weeds about other things that we don't have any control over, like dental care and things like that. And under objective number 2 under this section of non-clinical supports, it just felt like a very big objective that was hard to measure and had a lot of things in it. So we actually broke it down into 3 objectives. So got rid of that objective, improve access to quality mental hygiene services for minoritized populations, and made improve access to quality mental hygiene services for minoritized populations by completing an analysis of current state and local data available to identify gaps in access to care. Just something we can Ross, who helped with the design of that RFP and that whole program, is very interested in data. So he's going to do some data work on that, and then he can pull that together for us to review as a board so we can complete that by the end of the year. And then for 2025, improve access to quality mental hygiene services for our minoritized populations by supporting contract agencies with best practice data collection and processes. So we did a survey last year that asked agencies, what kind of help do you need? And there were a list of like 5 or 6 things. And this was the Conference of Local Mental Hygiene Directors put this survey together, and they were all different ways to support agencies. So I will be talking with the conference to see, okay, we all gave you what our agencies needed and they completed the survey. How are you giving us help so that when we ask them to give us data, they have already gotten some support from us so they know how to do it the way that makes like sense for our community. So that it sounded like there was an offer of help. So now I want to make sure we actually get the help for our agencies and not just say, here, give us this stuff and not give them any guidance. And then you get to objective number 4, improve access to quality mental hygiene services for minoritized populations by collecting and analyzing local data from contract and volunteer agencies. So we'll give them the help so that they can figure out how to do that well. And then under objective 6, it's about peers. There has been a lot of work, and like we have peers now in our FERS program. We just hired a full-time peer and another part-time position, and our clinic is going to start hiring peers. They're finishing the training series. They were a county select. We were an agency selected to do that training, and so one of those trainings, the different organizations across the state get selected to participate. And they're finalizing that training and will be hiring by end of year. Our new emergency housing model that we just put together with the opioid dollars incorporates a peer position. So we've really tried to enhance peer services, but it just feels like something we need to continue to focus our energies on. And there were so many other objectives, so we actually pushed that out a year, and we can continue to work on it every year. Adverse childhood experiences, goal area 6. The first one's promote greater awareness of the impact of ACEs in the lives of adults and children. And that one is specific to the mental health subcommittee. And Larry says they're going to do it in 2025. So that's one. Goal 7, transition age youth services. This one was actually specific. The first objective was specific to the Developmental Disabilities Subcommittee, and they put a lot of effort into this goal this year. And so we thought they would need till 2025, but they actually got it done in 2024. They've initiated meetings with school officials to provide information on ways to improve transition services so kids don't graduate to the couch from that system. They've encouraged school officials to participate in subcommittee meetings, and they've worked to improve communication between OPWDD providers and school staff in 2024. Specifically now, we have subcommittee members who attend 2 CSE chair meetings, along with the OPWDD transition team. And we also have subcommittee members who attend 2 all school counselor meetings, and then there's another meeting just for school social workers. And we have subcommittee members who are attending those to keep the idea of transition youth on the radar of school systems, because that last individual educational plan that IEP children get in high school really guides what they're eligible for in adulthood and what kinds of supports they can have. And Jen, you can probably speak quite eloquently to this topic more than I can, but they've done a tremendous amount of work and have attended a lot of meetings. I was able to go to one, and they're like, okay, what are you going to talk to us about whole health? I said, absolutely nothing. I'm here to support the subcommittee and their efforts in the local services plan. I'm not here, for like the whole health department. We had other people from whole health for that, but just to show the hard work that the subcommittee has done this year in that area. So you see the numbers. Thank you. We got members here, thank them. And the mental health services for youth, including transition age youth. The mental health subcommittee just held an amazing forum with school officials to better understand gaps in services for youth. And we have a board member right here, Jessica, who applied for a system of care grant that's focused, is going to complete focus groups with youth and understand what their needs are. So our subcommittees are doing a lot of work in this area. And then the substance use subcommittee will be reviewing the Clyde survey data. So that's the survey that's done every other year. It's every other year, right? Clyde survey every other. And they survey
System one.
the school where they ask kids about their substance use. And it's pretty concerning. They also use a specific survey here in Tompkins County. They got permission from Office of Addiction and Support Services to use a different survey tool here than they use in probably every other county in New York State, because it has some additional questions around depression and some other issues that youth are facing. So that survey has a lot of additional information in it on the mental health component. And I just did a presentation for the Youth Services Board maybe last month and did a lot of research on just the youth who are using substances. One of the theories is that they really are developing a more severe mental illness. And as a result, as a way that they cope with that serious illness, they are using substances, and we're still not doing a very good job, as we have in one of our goals, right? Mental health and substance use treatment. And the increase in risk is significant. Our staff just did a training. We had somebody come in from Cortland who talked about the needs of LGBTQ plus youth as it relates to suicide risk. If you look at the data on suicide risk and youth who use substances, it's actually worse than what you see in the LGBTQ plus community, which is pretty horrific, like the increased risk of suicide. So more work to be done in that area, but all the subcommittees are really addressing that one. So that's the plan. I did get an email from Sally McConnell Gannett, who could not be here, and she had just a couple of recommendations that say will be completed instead of saying it will be completed. I don't know if I have a choice. I think it's a box. I just have to fill in a bubble, but if I can't, it will be completed. I can do that. And to clarify some of the language on page number 6, a clinician on the co-response team has become the trainer in the CIT model. She felt it would be better to just say they're trained. So they went to the train the trainer course. So you learn to be a trainer, but technically they're really just a trainer. So I can take the train out of there. Any other questions, edits?
So I just have one thing. So actually, this was literally my dissertation. So this is just a passion of mine. So talking about transition youth. So my dissertation was on models of support for mental health for transition. Specifically, one of the gaps that I'm seeing that's not included right now is for people who are, that are in the transition age that also have comorbid chronic medical conditions. So not just, okay, they have comorbid substance use, they have comorbid other, developmental disabilities, but medical conditions. So I think somehow incorporating that in there, because I'm thinking in terms of the chronic people, the fact that, they're constantly in and out of the hospital, they are having all these extra stressors, they're, missing school, they're having all these other things. Like there's a lot of similar issues. And we don't have that included right now as an area of focus.
Where do you think would that go better under cross systems? Do you see that or are you saying that's more of the transition age youth? Should that be?
So for me, I think it could go both. Because I think it is a both thing. I think it's like, so obviously, like I said, my dissertation was focused more on transition services in general, but it's something that I think for adults, it's just as important is to make sure that we are incorporating that integrated care support. So that somehow we're notating that these people with chronic comorbid medical conditions also are needing additional support, because there is a lot of statistics behind higher mental health needs in relation to that.
I would vote putting it under cross-system service.
So it covers both.
Cross systems?
Yeah.
Okay. As a separate objective, or should we put it in an objective we already have?
My thought was that if it was gonna be in one that we have, my thought was objective one.
Okay.
But I'm not sure if that makes the most
Hasn't
sense.
objective one been taken out?
Well, that one's not the one taken out. That one we added social health
They
needs.
adjust it.
So we could just say social health needs, including individuals with chronic medical conditions that increases their risk for.
And Larry has a comment as well.
Yes, Larry.
I just wanted to say about that. I think putting it in is fine. I also think that we need to really understand what we're taking on and how that would work. And particularly the language that the subcommittee that is responsible for this addition would use, because it is we have responsibility for people with mental health, people with developmental disabilities, and people with substance use needs. And so I just want to make sure that we understand what it means to broaden a little bit what we're being responsible for. The other thing, and I'll just say this quickly, I think that Harmony deserves a lot of credit for keeping us on track with the plan, but also doing the daily work of making the plan go forward. Without her paying attention to and making sure that certain things are happening, I don't think the subcommittees would have been as successful as we have been. So this is just proof that in order to do what volunteers want to have happen, you really need people whose job it is to help those volunteers translate what we want into action. So, and I know that the LGU and the Community Services Board and the administrative staff make up the LGU, so it's a little different, but I don't think Harmony's role in making this being as successful as it has been can be understated.
Thank you, Larry.
Yeah, thank you, Harm.
We also have some very, very passionate chairs in our committees, there's subcommittees and membership here, and it sounds like you're going to be a guest speaker.
I am.
Yeah, to talk about that higher, but we have to get good at focusing on who are the people that may likely need our supports, right? And how do we make sure someone's addressing that? Now, like,
I think Larry had a good point, though, about that medical conditions aren't really in our area of expertise.
but it is a
So to speak.
comorbid risk factor, right?
Yes,
So,
exactly.
yeah.
Just from that, so I
That's what
wrote
we're trying to.
as it relates to a comorbid risk factor, but
It's
not,
factors.
as we just got dental out of there.
Yes, yeah. It's literally just in general, because I worked in pediatric oncology for years. And so I spent 5 years in there, and the level of supports they need is significantly different. And so just like that chronic medical conditions where they're constantly hospitalized, constantly needing additional support, it needs to look different. It needs different types of support. And, same thing for adults. So just trying to make sure that's taken into consideration, that medical aspect is a major risk factor.
Yeah, that makes sense.
So if I could just, I just had a quick comment and question. I mean, the plan seemed to be very comprehensive to me and an impressive use of this, the kind of structure that you're given. I did wonder the concerns about access to basic outpatient treatment, related to long waiting lists and to questions about the potential insufficiency of frequency of treatment. were they intended to be included in the original plan in some of this language? I wasn't sure whether that was the case or not.
You can include a lot of things in the plan. We did not have that. I don't think we had that as a specific objective to increase access, but you could probably put it in there if you want to add an objective for it.
We somewhat have it as under the equity, because the way I think about it is our biggest concern area is for people who don't have commercial insurances, right? So I think in my mind, like under non-clinical supports, which, yeah, right, maybe it should exist somewhere else, but like objective 3, yeah, all the objectives under there in terms of improving access to quality mental hygiene services for more minoritized populations, I think is where we start.
I feel like part of it could also go under the workforce, because like I'm thinking about Guthrie, they've had open positions for months that are waiting to be filled, and I am booked into October. Like, so I think that's, and so I think that's the other place that would.
I think that may have been like, I think it's a little bit better than it was last year, the workforce shortage, but it's still pretty bad. And I think that is where we saw the access piece coming from. That is true. Because a lot of places, it's not like we need more programs necessarily as much as we need more people to actually fill the roles in those programs.
Well, related to what Jessica said, would it be possible to add the language to minoritized and uninsured populations? That would be responsive to what you were getting at, Jessica.
Yeah, that would be consistent with what I'm getting at.
Does that take away from the diversity, equity, inclusion, and belonging focus of the work? I just hear that sometimes, like, don't dilute goals that are around diversity, equity, and inclusion with, because we could talk, I don't know, like, we can add another objective that says, just make another one that says, monitor and support the development of needed outpatient clinical services or something like that.
Access to outpatient.
Where get its own thing.
I said this to my colleagues on the substance use and the developmental disabilities committee as we're working on this plan and the update. Just because something isn't in the plan doesn't mean that the subcommittees won't address it. And if the Community Services Board wanted to say we really need to look at access to services, I don't think that needs to be, plan update until we get a more solid sense of what we mean by that. So I guess I'm not in favor of finding a place to put it in this plan update until we actually talk about whether we want to focus energy there. I don't disagree. I just would want to have a longer conversation rather than figuring out where to stick a sentence in this plan update, because we can always update the plan. And as I said at the beginning, we do lots of stuff that's not tied to the plan.
I'm wondering too, aside from monitoring it, what can we, or what could we or the subcommittees really do? I mean, you're just saying Guthrie has all kinds of vacancies. We can't, like, what would our role be in trying to fill those vacancies?
I think from my perspective, I think even if we can have a way to help with advertisements or like sharing the information or, something like that, like just to support it of like, okay, hey, if you're a local mental health provider looking for a position, here is from all different agencies in the county, here are open positions, or like something like that, where there's like some sort of collective support. Obviously got to review one of them, but like all the different places, just to be able to say like, hey, here's open access of, you know, things to kind of promote that there are availabilities. I think that's the first thing that comes to mind. I'll try to think if there's anything else I can think of, but nothing else off the top of my head. I just know it's been a chronic issue.
We could also support the facilitation of a more streamlined process of getting trainees from outside the county to come into the county
That'd be helpful.
for mental health.
Yeah, and I think we've talked about, local colleges, offering a master's social work program. I mean, to me, that's,
Stop, yeah.
yeah.
Yeah, so I think those kind of things would be helpful to have those options to at least fill those roles, even if it's on a, rotating basis, but to at least have somebody in those roles, because there's nobody but me.
And I agree, but to Larry's point, I think there's a lot in this plan already. Doesn't mean that we can't work on other things. We talk about a survey. I would like to get the results of that survey, and maybe that might be helpful to us. I don't know.
Which survey?
I would just look at the workforce.
Okay,
Objectives.
we'll have that done by the end of the year, so.
Uh-huh.
Yeah, we're still working on that. I mean, I think access is super important, and it kind of does feel to me like it's not like glaringly and like access to care. I think that is the direction we went, because every place we hear, like the second thing under the workforce is, what we're trying to do is how many positions are vacant, what's your turnover rate, what's it related to, that kind of thing, and trying to get that from a broad group of people, organizations. And then you want to get, and what's its impact, right? So how many program closures have you had? So by the end of this year, our subcommittee chairs talked about, they will each write up something about the closures that have happened. OPWDD has probably been the system hit the hardest. If you look at residential programming, they've been the hardest hit. We just saw what happened with Alcohol and Drug Council, and to a certain extent that was related to not being able to hire nursing and other medical staff positions. So we had our community residents on a hold for a period of time because of a staffing shortage. So when you look at the highest level of care, it's in the community, it's very clear on the numbers of slots where people are supposed to live and get specialty care. That's been a huge impact. And then hopefully by next year, we will get more of that impact piece from agencies, but we're getting a tool we learned sounded great in theory, much harder in reality when they're different kinds of organizations. So the questions may look a little bit different if you are licensed by one organization, OPWDD versus OMH, or if you serve a different kind of group, and how do we put that together? So our first year is probably going to be a pretty simple survey, but we should have that by the end of this year.
I just want to do a time reminder. It's 9 of, and we still had that item from the conference we went to. So do we need to approve or adopt this plan?
Yeah.
And what are we doing about the suggestion about changing anything? It sounded like there were two sides to it, so I just want to make sure we know what we're doing. Are we adding anything about? You look puzzled.
I'm trying to figure out how to resolve that. I mean, that's sort of up to you. Do you want to put a motion out and ask to add an objective around improved access to, and do people feel?
What if you just change the language of minoritized populations to populations and groups? And I would argue that would include low income, Medicaid, uninsured. That would be inclusive of all that. I don't know, that's a suggestion.
And then have we resolved what you brought up too?
Well, I think it's
It's the same thing,
Yeah.
okay.
Yeah.
wonderful.
Wants to change.
I was thinking that was what we should have done before. That's okay. Okay, so am I asking for a motion for that or not?
I think you're asking for a motion plus a caveat to change some of the language that we could
I
agree
can't
on.
quite hear you.
Vote on.
I couldn't quite hear what you said.
I think we're voting on this a plan with a couple of changes, suggested changes that was mentioned, get an agreement on that, and that should be perhaps the motion that we should put forward.
Okay, so there was agreement that we're making those changes, is what I wasn't clear on.
I mean, we'll see if there is, but I
Okay,
got a sense that.
great.
Yeah, I think what you were saying, Harmony, about the minoritized populations, I don't think we wanted to dilute that. I think there are some real issues that are very specific to minoritized populations. That there's, that they're dealing with issues that perhaps not all of us are dealing with. So I think I tend to, I agree we need access. I'm not really sure if this is where we want to put it, because I am also afraid that we dilute this. We lose our focus on minoritized populations.
Okay, does someone have a motion?
Separate objective.
If we're putting it in, that would be my thought process.
I guess I
Put in another objective.
that would be my preference. And Larry has his hand up too.
I'll make a motion to accept the suggested changes from the subcommittee chairs and from the chair of the CSB, because those are the people who made those changes. And I would also, as part of that movement, say a language about improving access to mental health services will be added to the plan where it seems appropriate to do so, and then leave it to Harmony to figure out where to put that. Because Harmony,
Objection number 7, already there. All right.
Okay, do I have go ahead. Larry, were you going to say something else?
because Harmony's the most knowledgeable person about how to put stuff in the plan, so it makes sense.
Right, yep.
I would like to second that motion.
Yes.
All right, we have a first and a second, all in favor? Right, unanimous. So the final thing on here, I believe, the final item was about what Harmony, it was up front when people came in, and it was about a resolution, I believe, that had to do with people who are detained because of illegal activities or whatever, and they have mental health or developmental disabilities, and making a change in that.
Right. So the Conference of Local Mental Hygiene Directors is hoping to make this a bigger issue for the state legislature. The law is called, people call it for shorthand as Criminal Procedure Law 730. And basically what it means is that if a person commits some crime or is accused of committing a crime and they go to court, and it doesn't appear that the person has the capacity to aid in their own defense, it's not concerned with whether or not the person understood what they were doing when they committed the crime. It's only related to whether or not the person can aid themselves in their own defense. They understand what the judge's role is. They understand that their defense attorney is trying to help them and that they should, work with their defense attorney on their own defense. They just are aware. So what often happens when a person, a 730 order, I'm ordered to find evaluators. It's often typically for people who have some sort of psychosis, right? And they're so mentally ill at that time, they really they don't have that capacity. However, sometimes we've seen a significant increase in the number of orders that have happened across the state. And there's also been several states that have been sued in class action lawsuits because the people's rights are being violated by these old laws. So they say in the first statement that the law hasn't been changed, since the 1970s. Or I think that's in the second whereas. And then mostly what happens is somebody's found not competent. They get medications. You still have to get medication over objection in a hospital if somebody does not want medications. You have to go through a whole legal process for that. But mostly they do restoration services, which is not treatment services. It's education about, they take them into a mock courtroom and show them what a courtroom looks like and explains who everybody is and what they do. So it's not treatment. And oftentimes it's confused with treatment by judges. So sometimes judges may sometimes prefer to do a 7:30 order thinking this person's going to get treatment. And they can maybe get medications ordered, but they're not getting the standard treatment. In fact, there's no discharge process. Right? So if somebody goes to our acute care hospital at Cayuga Medical Center and they stay there for 2 weeks and they need more care and they go to Elmira Psych Center, or they go to Greater Binghamton Hospital, there is, before that person comes back in the community, a number of meetings that happen with local providers to figure out who's going to be their case manager, where are they going to live, who's going to provide their medications. All of that is figured out well in advance before they're discharged. Not so with these. The people just get sent back to the jail and then they're back out in the community. And that, and if it's a misdemeanor that a 7:30 order is done on, they may go to Greater Binghamton Hospital for 3 days and then they're just released. The charges are dropped. They're just released back in the community. And there's not really any good care follow-up that's happening with these. So this is really, and then in other places, there are people who have been confined for many, many years, other counties in New York State where people have been still in the 7:30 sort of limbo land where you're supposed to get an education, right? How many years is someone going to try and educate you on understanding the role of the court? And to be in that kind of placement for over a decade is really egregious. So that's one of the other things they really want to see changed. New York State, there's only one other state besides New York State where the counties pay 100%. They talk about in here how, it may be $400,000 or more for your county. So for us, last year alone, we spent $1,464,886 on these services. No discharge planning process, right? And a person really not fully getting treatment. So they want it to be clear in the law that the person's not fully getting treatment. They want it's a $1,300 per day and you pay the full rate. There's no utilization review, right? If you use your insurance to get healthcare, somebody has to prove you really need it. There's no communication that OMH state hospitals would need to communicate with the counties about how these services are being provided. Is the person getting better? Are you doing family therapy with them? What are you doing with them? And are they getting better? And are they going to improve? Limit the amount of time a person can be expected to get improvement. And also create an opportunity for the person doing the evaluation to say whether or not, in their clinical opinion, you're either a psychiatrist or psychologist, that you believe that there's a reasonable chance at restoration. So if a person has a certain IQ, right, or severity of illness, restoration may not even be possible. So why are you this is not your mechanism. There are other programs under Article 9 facilities that can support a person if they need that higher level of care, but they shouldn't be held 100% county money if they're not really appropriate for it. So I think those are the highlights of and all the money that they're going to look at. What they want to do is look at the averages that counties have been spending on these services and have those dollars be reinvested into community and mental health services instead of being wasted, going on this sort of cycle. So their thought process really was if community service boards would review and approve and was taken to legislature and county legislatures approved that said, we're spending this money, we want to spend our dollars better. This isn't saying people don't need mental health care, but it's not necessarily a good thing for the person getting the service. And the costs are really very high without a lot of oversight and real treatment and support. And then they can really start to push this as the issue that they want to see reform in at the state level. Yeah, there are other states that one of the good things in New York is, in other states, they put all the misdemeanor and felony 730s together, and people sometimes languish in jails for years before they even get their evaluation done. So there's been lawsuits in Pennsylvania and California, and people's rights have just been egregiously violated because most states still have these pretty old-fashioned laws.
So I'll make a motion that the CSB adopt or accept this, the reform to the state's competency restoration process and support the passage of S1 1874. Do I have a second? Great. Okay, all in favor? Great. It would have been helpful.
I want to be listed. I'm sorry. I want to be listed as abstaining because I don't know enough about this bill and how it will actually work.
It would be helpful if we got this in advance so that we could all have read that. I'm not trying to, I'm just saying in future.
Would have been helpful, yeah.
Yeah.
I mean, I want to be listed as abstaining because I don't have enough information to make a decision.
Okay.
I'm not opposed to it. It sounds like an important thing, but I just don't feel like I know enough about, first of all, the process that exists now, and second, what the changes would be. And I actually think that this is probably not going to go anywhere in this session. And so we have plenty of time in the next session to support the reintroduced bill. But anyway.
You correctly say that we're one of two states that pays for this via the county without any fed or state funding?
Without any state funding, yes.
Okay.
That changed. It used to be 50% share and it changed a few years ago.
Okay, it sounds like,
And since COVID, I think the numbers of 730 orders being issued has really skyrocketed across the state. It used to be fairly rare, but it's going up everywhere. I think it's a symptom of like not having all the service, the access to care that people need, not having all the services that we need. It's a part of the workforce problem. It's just one more measure, but it's not really solving things the way it's written. It's not necessarily making things better.
Due to time constraint, I don't think we have time to get into that, but that might be something for us to discuss a little further down the road.
Do you want to wait and do this, bring it back next time?
Keep that up there, but in my head, we're paying for something that somehow 48 other states found ways to help pay for that. So not to reinvent the wheel. What are they doing that we're not doing that we could maybe do?
The next to the last item is interesting and important. It would require LGUs to reinvest savings from these reforms into community mental health services. That's actually very nice to see that. And one of the things that a group like this might do if it does support this is to make sure that stays in the eventual legislation, because that's the kind of thing that can often get wiped out at the last minute. But the intent here is, I think, really important. So.
Okay, so I wanted to mention one other thing, and that's that next month, we're trying to get the new executive director of NAMI to come and talk about their services. This was a suggestion by Sally, and I think it was a good one. And then Harmony and I have talked about in September having a kind of a larger meeting about the homeless situation and the different services, because we wanted to get a little time in there and make sure everybody's going to be here, because sometimes attendance is a little lighter in the summer and we don't have a meeting in August. So that's what we're planning, just an FYI. And we can certainly have Mary talk the beginning maybe of next month's meeting about nominating committee, if that's okay with you.
Sure.
Okay.
Did everyone see the article about the jungle in the New York Times front page 2 weeks ago? It's really.
I was a few people hadn't seen it, so I said I would send it to the whole board.
Oh,
What is it?
The article about the jungle in the New York Times.
Oh my God.
It was in Monday or Tuesday, New York Times last week.
Sunday.
Was this Sunday?
Yeah.
Oh,
Oh, was it?
It was
Okay.
right after we had.
Because we're the only county that's dealing with the homeless. I always hate it.
It's about the murder.
It's because the murder, I think, of that
13 people
that
associated.
person, yeah, makes it more
We're telling.
more of a newsworthy story, so they can exploit that to call attention to it, is what my impression was. So do we have a motion to adjourn?
So moved. I'll second.
Okay, I just want to give you back your pen before I forgot it.
We'll see you at 8 a.m.